and host, the PS and the CMO, and Dr. Ennis, who is online. We have not had COVID conversations for a little while for a number of reasons, but we have tried to keep the country updated on the statistics daily as it relates to numbers, the positivity rate, the new infections, hospitalizations. So the data has been out there daily, but not a conversation as we normally do on a Thursday. But we're happy to be back, and we'll continue as needed to keep the country updated and informed as we work together to overcome the COVID pandemic. A lot to outline today in terms of where we're headed, where we are, and we are making some progress, which is good in terms of the numbers coming down. However, clearly we can't afford to be complacent because we are still in an active pandemic and therefore need to constantly remind ourselves as to the risks and the protocols that should be observed. So let me just begin by asking Dr. Jacqueline Bisesa-McKenzie for the surveillance updates, and then we continue the conversation. Dr. Bisesa-McKenzie.
Hi. Good afternoon, everyone. Good afternoon, colleagues. So this is the update with data as at the 9th of June, 2021. So we now have 49,110 confirmed cases, as 20 new cases were confirmed on the 9th. We are at a total of 989 deaths. This means our case fatality rate is 2%, with a daily positivity rate for yesterday of 2.7% and a 7-day average positivity rate of 8.2%. Just to look briefly at the comorbidities and risk factors in COVID-19 related deaths, 3 out of 4 deaths are 60 years and older. 6 out of 10 deaths have cardiovascular disease. 4 out of 10 deaths have diabetes. 1 out of 10 deaths have neurological impairment. And 1 out of 10 deaths have chronic kidney disease. Again, emphasizing that it is the elderly persons and those with comorbidities or comorbid illnesses that are at more of a risk for severe illnesses, hospitalizations, and death. Across the country, this gives us, the slide up gives us the cases by parish. And as we said before, we have 49,110 cumulative cases since the 10th of March. But over the last 2 weeks, we would have confirmed 772 cases across the country, with the heavier concentration of cases being in Kingston and St. Andrew, St. Catherine, St. James, St. Anne, and Manchester. In terms of our geographical spread, the number of communities that are now affected, we have 276 of the 783 statin communities that we have had confirmed cases over the last 2 weeks. And that is 35.2% of communities being affected. Where we would want to be is below 25% of communities affected in order to say that there is a low level of spread. Here again, we see where it is that we have the parishes that are least affected presently. These are St. Elizabeth, St. Thomas, and St. Mary, where we have low levels of spread. The other parishes, we have medium to high level of spread. And we would have seen that our highest level of spread geographically has been at a level of 80% communities being affected, and this would have occurred in March. Since then, the number of communities have been declining steadily, and as I mentioned before, to 35.2% of communities presently. In terms of our confirmed cases by date of onset, we would have peaked on the 8th of March in terms of the number of cases. And since then, we have steadily been declining in terms of the number of cases that are confirmed each day. This, of course, is a reflective of the number of tests that are being done, and we have noticed that we have been seeing a decrease steadily as well in terms of the number of cases, number of persons that are presenting to be tested. In terms of our admissions, or 7-day average for admissions, that also would have peaked in March. And since then, we have been steadily declining in the number of admissions. And over the last couple of days, it has been a little bit up and down, but we don't see any steady increase right now. But we are watching this carefully in terms of the number of cases being admitted to hospitals. The parishes that we are seeing the increase in cases are St. James, and also in St. Anne, we are seeing an increase in the number of cases. And the other parishes, we are seeing a steady decline in the number of cases, but also in St. Thomas as well, we will be seeing an increase in the number of cases. Next slide. In terms of deaths, we would have heard that, we would have seen that we would have been reporting on a number of deaths recently. And this really has been because there have been a number of deaths that have been under investigation, that the team, because of the decrease in number of cases, certainly have been getting an opportunity to go back to these cases, to examine them, and to be able to classify them as to whether they are COVID deaths or whether they are coincidental deaths. So despite the fact that you would have seen some high numbers recently being reported, these deaths would have occurred sometime in the past, and our actual trajectory in terms of the number of deaths happening recently over the last couple of days is that there has been a steady decrease, a slight plateauing that we have been seeing over the last couple of weeks. And then where you see a drop at the end of the curve, of course, we have to wait on the cases being investigated to see if that will either continue the plateauing or whether we will have a continued decrease in the number of cases. In terms of the bed occupancy, just a reminder that, some persons question whether or not the decrease in our bed occupancy would mean that we would be approaching low level of risk in terms of bed occupancy. But you would see where we would have classified our present status as being at a high level of system pressure in our hospitals because of bed occupancy. And this is because although we have quite a number of beds, up to over 700, that we would have reserved as COVID-19 beds, only about 150 of those beds are really new beds. And so the utilization of beds anywhere above that 150 puts the system under stress because it is taking up beds and resources that should really be used for general occupancy for other patients, other illnesses that present to the hospital. So, next slide. So you will see here that we are still in the orange band, even though we have come down to just about 300 over the last couple of days on average in terms of beds occupied. We still need to get to half of that to be below the 150, where we would feel that the resources utilized would not disrupt other services in the hospital. So this is still a cause for concern, and you will recognize that the present status where we are at, despite that we have seen a drop, it still puts us at about the same level where we were at September last year, when it was that we were under pressure. And though there is an increase in the number of beds, other resources such as human resources, supply resources, all of those are stretched to be able to manage the number of cases we have in hospitals. In terms of our reproductive number, this is another indicator that we continue to track to see where we are in the management of the pandemic. And we have been gradually decreasing. We want to be below 1, because if we have one person spreading to less than one person, then it means that we will have be limiting the exposure that there is in country, and that should translate into a decrease in the number of cases. So we're at 0.9 now in terms of the reproductive number. We certainly had mentioned a couple of weeks ago that we want to get to be about 0.7 and lower going into the summer period, because we want to ensure that all the events that occur in summer would not be causing a spread or a surge in the number of cases. So getting us from 0.9 to 0.7, 0.5, that's what we want to see, a continuous downward trend that is only going to happen if there is decreased spread and decreased exposure. And this is the graph that is on the screen now that shows the reproductive rate. And you will see two lines, because we do calculate the reproductive rate using two set of data. One is the number of confirmed cases, and one is the admissions. And the admissions is a better indicator in our estimate, because it is more objective, because once persons are sick, then they are going to show up in our facilities. The number of confirmed cases is the poorer choice here, because again, we say that that is really reflective of the number of tests that are done. And you will see that the reproductive number using the number of admissions is a little bit higher than the reproductive number using the confirmed cases, and that we've had little bits of peaks above 1 over the last couple of days. In terms of our positivity rate, again, this is another indicator. We have seen that we were as high as almost 40 in terms of the positivity rate. We recognize over the last couple of months that where we want to be is below 5%. At that time, that would suggest that the level of transmission in country is low, and low enough if that less than 5% is sustained for us to comfortably or reasonably think that there would not be an increase in the number of cases as we reduce restrictions. But still, we have not quite reached there consistently. Over the last 2 weeks, we would have seen that we ended last week with about an 8.8% 7-day average in terms of the positivity rate. And the week before that, we were at about 10.7%. That was our average 7-day positivity rate. So this week, we have had some low numbers, and we will see by the end of the week what our 7-day average rate would have been for this week. But right now, we are trending down. Next slide. Next slide. So again, just to mention that, interventions or non-pharmaceutical interventions have been effective. And I think everyone would have seen with the increase in interventions, we were at a peak on about the 8th to the 12th of March. That was a bad time for us. We were suffering greatly in our hospitals. We almost touched a point where we were out of oxygen, where we were challenged severely with bed space, where our bed occupancy went above 700. And that had put our human resources in terms of our healthcare workers, both the ones that were clinically managing the patients, as well as the public health workers who were managing the contact tracing, etc., under severe pressure. We would have put in several interventions, and these are similar interventions that we would have used over the last year. And we would have found that these have been quite effective in bringing down our numbers. The most effective restriction that we have seen has been the gathering restrictions, where we would have put a number to say that you could not have more than 10 persons gathering, and certain large public events were prohibited, and we had weddings, etc., funerals, etc., that we had decreased the gatherings for those events. Our second most effective intervention would have been our curfews and the special geographic restrictions that we would have had earlier in our parishes when we had noticed that there were increased spreads that were localized to certain parishes. That also was quite effective in bringing down the numbers. Next, the border closure that we had last year after March going into April and May, that also was quite effective in bringing down the numbers initially. That's very, very small surge that we had in March, and again in August when we had decreased the amount of persons that were coming into country. Next, physical distancing or public transportation measures, the shielding of the elderly persons by restricting these persons to stay at home and decreasing their risk of exposure, work from home, the barber and salon closure, general work hours restrictions, and school restrictions have all been found to be effective in decreasing our numbers, and that is what our epidemiological curve does show, that with the introduction of these measures, we have significantly brought down our numbers. In terms of vaccination, unfortunately, we have not reached very far to say that vaccination, the level of vaccination in country will have an impact on transmission. We would have seen that several countries would have increased their vaccination rates, especially larger countries from where a lot of persons travel to Jamaica, and vaccination rates going above 30% would have impacted those countries, causing them to have smaller numbers, decreasing numbers, and also prompting release of restrictions. In Jamaica, however, our vaccination rates are not so high, and that, of course, is going to be impacted by vaccine availability, but also by vaccine hesitancy, as we still have persons not coming out, especially in the over 60 population, to get their first doses of vaccine. So we still have over 93% of persons that are not vaccinated in country. And this certainly puts us at risk for virus coming into country, especially variant strains, because if we have a population that is naive to the virus, and the majority of the population is, then it certainly means that if we have a more transmissible virus that comes into country, then there is the possibility of spread, and spread rapidly. But also, even without the variant strains, the very fact that as much as 93% of the population has no immunity, then that would mean that even the wild strain, which is the strain that is regularly around, that strain does have the possibility of spreading as well. In terms of vaccination, this would show us that the take-up rates in terms of the age groups, and we see that for the 60 to 69 age group, we have 14.3% of persons who would have gotten their first dose only, and 2.2% of persons who would have completed, that is, gotten 2 doses. 70 to 79, 5.6% of persons have gotten 2 doses, 17% of persons 1 dose still. Over 80 age group, 7.1% of persons would have gotten 2 doses, and 12.6% of persons with first doses only. So still there is a large number of the vulnerable groups, on average maybe over 80% of persons that have still not gotten their vaccinations. And it is important that these persons come out and get vaccinated. A reminder again that the vaccine does prevent your likelihood of getting a severe disease, of being hospitalized, and having deaths. And again, a reminder that this is likely to happen in the older age groups, the over 60 age groups, if they are exposed and become infected. They are likely to have more severe illnesses, and we need to have them vaccinated so that we can protect this population. So this is a summary of our indicators. So in summary, therefore, 35.2% geographical spread, and we want to get that down to 25% to feel comfortable. In terms of bed occupancy, we're at a high level of bed occupancy. We want to get that down to certainly below 150 beds being occupied on a daily basis. In terms of our positivity rate, we're at 8.2%. We want to get that below 5%. Our reproductive rate is at 0.9%, and we want to keep it there, and we want to keep it down further to get it down 0.7, 0.5. And our vaccination rate, we certainly want to get that up, especially for the over 60 age group and those with comorbidities. I think that's it. Thank you, Minister.
Okay, thank you very much, CMO. So there you have it, ladies and gentlemen. We're making some progress, and there's reason to be encouraged that the numbers are trending down, and we are seeing improvements in all the indicators. Nevertheless, it's not an invitation to encourage a lack of observance to the protocols. I want to use the opportunity to really appreciate and commend, firstly, the public health team in the field. There's so much going on. I know persons are tired, but they've remained true to their mandate, and despite the challenges, have really worked to provide the guidance that is necessary in all areas of the response. And certainly, we couldn't do it without the Jamaican people and their efforts at observing the protocols, despite the fatigue that they are suffering in terms of having to observe those restrictions. So I think it's commendations all around to all who have played an important role. The Prime Minister, you would have heard, has announced the new disaster risk management, the new measures for infection prevention and control under the Disaster Risk Management Act. And these measures have been, generally speaking, have provided greater relaxation to the non-clinical measures. The CMO had outlined a slide where she gave the effectiveness of those non-clinical measures. With the relaxation, clearly will come an easing of the frustrations, the lack of restrictions around movement, restrictions around economic opportunity, restrictions around social activities. And, you know, there was a need for that. There was a need for that. As a government, we fully appreciate and understand that to be restricted in this unusual way over a year will take its toll. And we have seen manifestations of that in terms of mental health, in terms of economics, in terms of relating to friends and family, going to your favorite restaurant, your favorite beach or river, having people come together, you know, whether it's, you know, the last rites of a funeral or, you know, the celebration of a wedding or a birthday. So we understand that, and I think the government has been very responsive. And these measures, to some extent, have been driven primarily to respond to these harsh realities that have accompanied the non-clinical measures that have worked to restrict the spread of the virus, but have also come with consequences or side effects in terms of the restriction of movement and all the various ills that would have created or caused, even if it's just psychological or mental. So the relaxation really is responding to many needs within the society. And clinically, even though it may not be the optimal position from a clinical perspective, the truth is we have to look at all the competing needs within the society. And I think that's an important point to make. In making that point, I think from a public health perspective, we are also saying that it's important not to be complacent, to take these relaxed measures as a response to the concerns within the society, the non-clinical concerns, and to recognize that these measures should be utilized in a way that is responsible and should be utilized in a way that is sensitive to the fact that the virus is still there. The CMO outlined the number of persons who have been vaccinated, looking at the vulnerable groups, and there's still a long way to go. And as a consequence, the virus can still have an impact, and we can still get back into another surge. And so it's very, very important that we recognize that even while we celebrate and recognize the achievements of bringing the virus to under some level of control over the past number of weeks. We have now completed 13 weeks of vaccination, and as at Wednesday, June 9th, 2021, 161,850 Jamaicans have received the first dose of the AstraZeneca vaccine. This means approximately 8% of the targeted population, and that targeted population is 1.924 million. So that's 1,924,759. That's approximately 2/3. A breakdown by region shows that of the 161,850 first doses administered, 53% had been in the Sierra region, that's the Kingston, St. Catherine, St. Thomas, St. Andrew region, 18% in the Western region, that would be St. James, Trelawney, Hanover, and Westmoreland, 18% in Southern region, Manchester, St. Elizabeth, and Clarendon, and 11% in Nera, which is St. Anne, Portland, and St. Mary. As a reminder to everyone, a single dose of the vaccine does not provide full protection, and that's a message that we have to continue to push. You must take the second dose of the AstraZeneca vaccine. If you had another, the Johnson & Johnson, it would be one dose, the AstraZeneca. And so for persons who have had their first dose and have completed the 8 weeks or so, there's a little room there for, you don't have to be exactly on the 8th week. And so I don't want persons to panic because they may not get it on the exact day. But there is a process to make contact with you through text messaging or calls close to that date. And then you are given some instructions as to where to go to get the vaccine. I am aware that some persons are panicking about not being contacted, even though they're maybe 4 or 5 days away from the due date. And I'm saying that you are supposed to be contacted. Now, if you are not, you can either visit the location where you got it, but I understand where the blitz were hosted, the National Arena, clearly no one would be there to give you information. So you can call the 8881 number or visit your nearest health center, and there is one close to most communities, and inquire and let them assist you in finding out. It's not supposed to be the case, generally speaking, because we do have a database and we will, for the most part, make contact with you. So we want you to take your second dose. We're not going to ignore the fact that you have not, and we are encouraging you to listen out for that contact and be a part of that process. Someone asked a question earlier that persons are being asked to carry their TRN. Is that a general requirement, PSR CMO? I wasn't sure. I was on a radio program.
So, good afternoon, Minister. Good afternoon, members of the public. So, as was announced in Parliament on Tuesday by the Minister of Finance and the Public Service, the government of Jamaica will be providing a conditional cash transfer to persons 60 years and above for the purposes of being fully vaccinated. And so, in order for us to operationalize that transaction, we we are requiring persons, especially those 60 years and above who have a TRN, to take it along with them, so that that process can be, so that the transfer can be made.
The specific requirement is for the cash transfer, or is it? Because I was under the impression that it may have been for the database that we have installed.
We do collect as a data point TRN, but it's an optional requirement. But now, for the purposes of this conditional cash transfer program, we
should make it specific then that for persons 60 years and over who would qualify for this cash transfer, your TRN is necessary to process that transfer. So
once you have a TRN.
Once you have a TRN. So take your TRN in. It's not a general rule, even though we encourage it. And it would be good to put it on the database. I should say, read the database that we have now installed this facility. I saw it in action at the arena, is it this Saturday or last Saturday, and was quite impressed with it. I want to thank those who pulled that together. It was a UNICEF facility that we benefited from with the help of our internal team and the private sector team. Mr. Peter Meledo was a part of that, and I want to just express our appreciation to them. The system is we need to put it on display to show how it works one day, but it captures the data of the individuals. Huh? On Monday we will? Okay, we're launching on Monday. I need to update myself on these launches, right? But we will show how it works, but it's very efficient. It gives you real-time information, and it gives critical data points that allows us to assess and to make decisions in a much quicker time frame than if we had the paper-based system. So I think the response has been improved and enhanced by the use of this program. So take your TRN for better processing or easier processing of the cash transfer. I was on the point of the second dose and the importance of the second dose and the need to continue to follow the protocols as we go along, the mask wearing, the sanitizing, and the physical distancing. This is very, very important because, again, even with the relaxation, COVID is still very much alive and a threat to all concerned, particularly those vulnerable groups. The ministry also continues to administer second doses for persons who are due. As of June 9th, 2021, 28,355 persons have received their second dose of the COVID-19 vaccine. So 28,355, and that is an ongoing process. There are some persons who were due to receive in May who have not taken up who have not come to get the second dose. And indeed, anecdotally, we're still analyzing, there are some persons who felt that because they had the 1 day or so side effect, they have become afraid to take the second dose. I think it's important to stress that not taking the second dose renders the effects, the efficiency, and the protection of the first dose redundant over time. To put it simply, you are going back to square one, which means that you become as vulnerable as someone who never took the vaccine at all. And I think it gives you up to 120 days, I was told. We don't want that to happen. It would be a waste for you to get 3 months protection and then 3 or 4 months protection, and then you're back to square one. The virus we anticipate will be around for a while. So please make the effort to take your second dose. We have already begun to administer the second dose through our blitz operations. The first blitz was held Saturday past, June 5th. During that blitz, just over 1,053 doses were administered. 127 persons received the first dose. 926 persons received their second dose. And this was, of course, at the national arena. Vaccination continues island-wide this week at the following blitz sites. And we ask you to take note of this. If there are any changes or any additions, we will announce. In Manchester, the Manchester High School, 8 a.m. to 4 p.m. That's at the Manchester High School. This is June 12th, 13th, and 14th. So we have a 3-day operation, if you will, at the Manchester High School from 8 a.m. to 4 p.m. That's the 12th, 13th, and 14th. In Clarendon, it's June 12th, 2021, Bustamante High School from 7 a.m. to 5 p.m. So that's a Bustamante High School from 7 a.m. to 5 p.m. on June 12th. And on June 13th, Edwin Allen High from 7 a.m. to 5 p.m. So that's Clarendon, Bustamante High, 7 to 5 p.m. and Edwin Allen High, 7 a.m. to 5 p.m. In Kingston and St. Andrew, the National Arena, Saturday and Sunday, that's June 12th and 13th, for persons vaccinated April 3 and April 9th. So that's the second doses who should have a card with a date on it. You are going to get priority if you visit the National Arena on Saturday and Sunday, the June 12th and 13th. And this is for persons who received vaccines on April 3rd and 9th. St. Joseph's Hospital, Wednesday to Friday, June 9th to 11th, 9 a.m. to 2 p.m. So Wednesday to Friday, June 9th to 11th, 9 a.m. to 2 p.m. Today is the 10th, right? So that started yesterday. And Mona Aging and Wellness Center, today, which would have been completed, 9 a.m. to 3 p.m. And Friday, June 11th, tomorrow, 9 a.m. to 1 p.m. So Mona Aging and Wellness Center, tomorrow, Friday, 9 a.m. to 1 p.m. St. Catherine, this Saturday, June 12th, 9 a.m. to 3 p.m. at the following locations: St. Jago Park Health Center, Linstead Anglican Church, Greater Portmore Health Center. So that's St. Jago Park Health Center, Linstead Anglican Church, and Greater Portmore Health Center. Saturday, June 12th, 9 a.m. to 3 p.m. again, Eltham High School. That's Eltham High School. And Sunday, June 13th, 9 a.m. to 3 p.m., we go back to St. Jago Park Health Center, to Linstead Anglican Church, and to Greater Portmore Health Center. So both Saturday and Sunday, 9 a.m. to 3 p.m., St. Jago Health Center, Linstead Anglican Church, and Greater Portmore Health Center will operate as vaccine sites. And Saturday, 9 to 3, Eltham High School, and that's for St. Catherine. In terms of St. Thomas, Saturday, June 12th, and Sunday, June 13th, 9 a.m. to 3 p.m., Morant Bay Health Center. That's Morant Bay Health Center this Saturday and Sunday. So those are important venues and dates and times for persons receiving their second dose, and we will mount that information, Steve, on the website, and we will do some ads also to announce. But if you are uncertain as to your location, please contact your closest health center, your parish office, and get some information on where you would go this weekend. First dose vaccination continues. The ministry, through the regional health authorities, continues to offer first dose appointments for 50 years and older, healthcare workers, teachers, JCF, JDF, Jamaica Fire Brigade, staff members from PICA, Jamaica Customs Agency, and the Department of Correctional Services. Persons are all eligible to be vaccinated based on the implementation plan. And persons wishing to be vaccinated are reminded that they must make an appointment through the ministry's website, which of course is www.moh.gov.jm, or through the National Vaccination Hotline at 888-663-5683. That's 8881-LOVE, which is 888-663-5683. So we anticipate a fairly busy weekend as we continue to go through the second dose administration. We have the vaccines in stock, reserved for these persons, and we also can do or apply first dose for the eligible group, 50 years and older, and those other special groups that have been identified. We continue to work to get additional vaccines. You may have heard that we have paid down a fairly substantial sum, just over 350 million or thereabouts, for 1.9 million doses of Johnson & Johnson vaccines, with the first shipment to arrive in August. We are negotiating to get additional supplies between now and then. That Johnson & Johnson delivery will take place over several months. And of course, that is a single jab vaccine. So, we have secured supplies. The issue now becomes the production process and how quickly we can get the supplies that are on order. And we continue to discuss and negotiate additional supplies between now and then. We prefer to comment on that when we have some certainty in the supplies. Okay, I think we should break here and then move straight into questions. Stephen.
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose your questions to the members of the panel. We're going to begin with Christopher Thomas from The Gleaner.
Yes, good evening to Dr. Tufton and your fellow panelists. Here's my question. If Jamaica has more persons getting vaccinated, because we know that based on what was just presented, the vaccination numbers are kind of low right now. But if Jamaica has more persons getting vaccinated, will we as a country be in a position to make any similar announcement that like was recently made abroad, that vaccinated persons can go without masks, or those persons would get any similar relaxation of any measures? And also, if the vulnerability rate for Jamaica remains significant like it is just now, like was just stated, will it be a case where the health ministry will have to petition, for lack of a better word, for any further restrictions on travel from overseas to come to Jamaica, and thereby lower that risk that we get more cases coming from overseas to affect us further?
Right. So you've asked a couple of questions that are based on a number of assumptions, and the responses are going to be impacted by a number of variables, some within our control, others not. So the first one was about right, if restriction. Well, the truth is yes. I mean, if we don't anticipate that we're going to be living in this environment forever. The idea is to manage the risk, to overcome the risk, and hopefully over time, given all the measures, including the vaccines, eliminate the risk. And the world has gone through these scenarios before. So the CMO and others have said that we need to reach immunity, general immunity, herd immunity, if you will, and that we need to inoculate or vaccinate 1.9 million of our population in an ideal scenario. The truth is, the more you get to that figure, and you may never get to that figure, let's hope you do, but the more you achieve persons getting vaccinated, is the less the risk, because that is the most effective defense as of now. And therefore, you will see the elimination and the relaxation of the measures that are intended, the non-clinical measures. So yes, I would say yes. I don't know if the CMO wants to comment any further on that, but I think that's fairly straightforward. You want to add anything to that?
Well, Minister, certainly as the numbers improve in terms of our indicators and our vaccination level increases, then there is more likelihood of the reduction of measures. As to state specifically what those measures are going to be, It would be very difficult to say that now, but certainly that is the way in which we are going, that the better our numbers get, the more we get vaccinated, then the more likely we are to reduce more and more restrictions.
The second question about vulnerability and restrictions on travel. Again, it's a matter of risk. Other countries throughout the world and our key partners are clearly doing a lot to try and minimize and eliminate that risk. They are more ahead of us in terms of vaccines. They have been more privileged, if you will, to access greater numbers. And so to the extent that the risk there are low, then there is no need. To the extent that they may become high and we are at risk as a result of the travel, then clearly the government would have to consider all of those options. So that's why I said there are a lot of us options there, and we have to take it one day at a time, 1 week at a time, based on what is happening in the environment. Next.
Thanks, Minister. I'm going to go to Emma Lewis.
Hi, good evening. I have one question and one thing I wanted to clarify. The clarification was from CMO. You said, I heard you say 80% of the vulnerable groups are unvaccinated. Does that include all the senior citizens and all those with comorbidities altogether, or are you talking about 50 plus age group? And what percentage of the 50 plus age group remain unvaccinated? If you could clarify that. And then I had a question about testing. The CMO mentioned there are fewer people presenting to be tested. But what is your testing strategy now? Now that numbers are a bit lower and so on, are you going to be going out testing in communities, or you're just waiting for people to come to health clinics and hospitals to be tested?
Okay. In terms of the numbers, it is the over 60s that I would say on average about 20% of those are vaccinated on average, maybe a little bit lower when you work it out. For the 50 to 59 age group, we have less persons that are vaccinated. We would only have opened up recently to the over 50s, and so we have 1.4% of those persons that are fully vaccinated and 8.3% that have received one dose. So we have 90.3% that are unvaccinated. What was that? Okay, so our surveillance measures really have not changed. We are still testing suspected cases. We are still testing contacts of suspected cases. We're still doing our general hospital surveillance, and that gives us an idea of what is happening in the communities, because persons come from all over to be admitted for various reasons to hospitals. And we are doing our enhanced respiratory surveillance, where anybody presenting to our accident and emergency departments, our health centers, elsewhere in the hospital, those persons should be tested to see if they have COVID-19. So those are the general measures that we have used in terms of surveillance. We are noting that in these groups that we have people that are not testing, they're not showing up for their appointments. In our investigations, we have persons that are contacts. However, the primary case is not revealing who the contacts are because they don't want to face quarantine and isolation. So those are issues that we have, and we really would want to encourage the public that the more we are able to detect where cases are, the better able we are able to the better we are able to control the spread of the cases, and therefore the better able we are to confine restrictions rather than to have generalized restrictions. So it is in everybody's interest, and of course within the communities, within your families, if it is that you have positive cases, if you have contacts, then you do want to decrease the risk of your vulnerable persons, your over 60 age groups, and those with comorbidities from getting ill. So it is in your interest to be tested and to find out what is happening so that it can be treated appropriately.
Thanks, CMO. I go to Javon Keys from TVJ.
Good evening, everyone. Thank you so much, Stephen. My question is surrounding persons who are immunocompromised. So more and more studies are showing that the COVID-19 vaccine is not as effective even after 2 doses in 2-dose vaccines, and after the 1 dose for single-dose vaccines, it's not as effective for persons who are taking immunosuppressive drugs. One, I wanted to find out whether or not what percentage rather of Jamaica's population would be considered immunocompromised, and 2, whether or not, what is Jamaica's position on administering a 3rd dose for persons who are immunocompromised who may be affected by not being adequately protected by the COVID-19 vaccine after being fully vaccinated?
We do not, or I would not have right now the number of persons that are immunocompromised. The immunocompromised group really can cover a wide variety of persons, persons with disorders that affect their immune system's responses directly, and then you have persons who have other comorbidities that are just generally ill, and there is a depression of their immune response. So, and that can vary, in terms of the number of illnesses. Again, age, persons at extreme of ages their immunity is not as well as a younger, more robust person. So the very young and the very old also will have issues in terms of their ability to mount a response. We do know that persons who are immunocompromised, we are not absolutely certain of the level of immunity that they will develop after taking the vaccines. And we certainly would have to wait to see what is the guidance that is coming from the authorities on the vaccines in terms of their recommendation for 3rd doses. So if that becomes a recommendation, it is going to be something that has to be looked at carefully, because then you would have to be able to determine what is the level of immunity that is mounted by the person to say that this is inadequate and that there would be a need for a 3rd dose. So it's not as clear-cut as we would want it to be. It's not going to be easy to select that person for the 3rd dose. And so we really would have to look to see what the scientific and technical evidence is going to show where that is concerned.
Thank you very much, CMO. Damien Mitchell from the Gleaner is asking if you can explain why the number of active cases have remained above 20,000, even though the daily count of positive cases have dropped significantly for the past few weeks.
Cases that have been confirmed over the last 2 weeks. Now, we do have this backlog of 21,000 or thereabouts persons that it really is a matter of reconciliation of these discharges. essentially, some time ago, we had moved from a second test at day 14 to say that persons were discharged. And we moved to a clinical assessment, and the protocols would have changed to that after 14 days, persons would be released from isolation. And those 14 days would include 3 days without symptoms. So persons are advised at the onset of their isolation that after 14 days, if they have no symptoms, they would be discharged from isolation. Every effort is made to contact these persons from the parish health departments to advise them of where they are, find out if they have any symptoms, and they are given the message verbally that they are discharged. Many persons will attend the health centers if they do require a discharge paper to take to work or wherever else would want to know their actual status. So the reconciliation, though, in terms of the documentation of those discharges and then the submission to the National Center, where we have to reconcile those with what we have on our database, does take some time. And for the period March to April, we had thousands of cases that were confirmed. And so we are operating in a backlog of having those cases discharged. So it is really the 722 cases or thereabouts that are our active cases. Maybe a little bit more if we have ill patients in hospital who will go beyond the 14 days, or maybe even shorter in some cases. But it's just about that for the number of cases that are active over the last 2 weeks.
Thank you very much, CMO. We're going to go to Debbie and Wright from the RGR Gleaner Communications Group.
The persons who have missed their appointments for the second dose of the vaccine. I wanted to ask whether you had yet. Also, to the permanent secretary, whether persons who worked at the Blitz sites, whether all those payments have now been made, and also to the clinical team, in relation to the effects that persons have been reporting, persons who have been vaccinated, have you had any persons report effects on reproductive health, particularly on menstrual cycles, like disruptions in menstrual cycles?
Dr. Ennis is online. Is she still on? I'm going to ask her to address those questions, the issue of second dosers who have not taken up during the period. I think maybe you may have a more accurate figure for the month of May than you would for June, given that the month has just started. Dr. Ennis?
Yes, Minister, thank you so very much. And thanks for the question. We have some figures for the month of May, and we did some disaggregation just for the elderly and healthcare workers. So we actually broke it down by region so that we could get an idea of the types of interventions that would be necessary. So if I give an example, just for the Western region, for example, we looked at persons 70 to 79, and in that area, we would have just over 16,000 persons, and 3,774 would have accepted the first dose. So that would be 23% of the population of persons between 70 and 79 in the Western region. Now, up to the 31st of May, only 359 of them, or 10% of that 3,000 plus, would have received the second dose. However, I don't want us to begin looking at second dose misses as yet. We want to complete June to be able to give a more accurate data. If I go to the Southeast region now, which is where most of the persons would have been eligible to receive the second dose as of our Blitz on Saturday, if I give you an example of that same grouping, 70 to 79, In Kingston and St. Andrews, St. Catherine, St. Thomas, we have just under 40,000 persons, and 11,000 plus of them would have accepted the first dose, and 3,166 the second dose. That's 29%. So we want to wait until persons become fully eligible for the second dose before we actually pinpoint and give an accurate figure as to those who have missed. And we continue, as Minister has indicated, to encourage persons to come out for their second dose. With respect to your second, maybe your third question about disruption to the menstrual cycle, we have not received any complaints at the national level. We continue to ask persons and encourage persons, if they have any event that is supposedly attributable to the vaccine, they must report. They can report by going online and filling out that form, or they can go to their health center, their nearest health department, and make that report so we can do the investigations.
Can I just, thank you, Dr. Ennis, can I just comment a little on that, because I think it's important to bring context to the numbers on the second dose. The second dose, the first dose, in the early stages of applying the vaccines, there was a general narrative that we would apply a second dose between 10 and 12, 2 to 3 months. And so in some regions, some persons would have noted a 12-week or a 8-week and a 10-week return for a second dose. And I think, therefore, that even though we would have seen the 8-week pass, there are persons who are prepared and plan to take up the second dose within a 12-week period as opposed to a 10. Is that correct, Dr. Ennis? I just want to be clear because
absolutely, sir. Okay. Very clear. So there are still a lot of persons waiting, as they should, because the date they would have received would have been for 12 weeks. Okay. So that is why we really are asking for some time to complete June to give that accurate data.
Right. Thank you.
Great. Thank you very much.
With regards to the payments, we do recognize that over the past weeks, we have had quite a number of the workers at the vaccination blitz sites that have not been paid. And this is a function of a myriad of challenges, to include incorrect information and the fact that we are still processing payments for some institutions that don't work or their systems don't align to the government of Jamaica's payment system. And so we have given their commitment for all payments to be resolved by this weekend, and that commitment is being fulfilled. Last report that we made, we had paid approximately 83%. We are now up to 91% of the payments that are now processed. So we are moving to meet the deadline of completing all payments by tomorrow.
Thank you very much. PS, we have a follow-up from Javon Keys.
Thank you so much, Stephen. My next question here is about vaccination of children. More and more you're seeing the vaccine makers applying for the ability to have their vaccines being administered in children. I wanted to find out where are we as it relates to consideration of administering COVID-19 vaccines to children. I mean, schools, educators are eager to see schools reopening, and that will definitely likely be a part of that strategy.
Thank you very much, Mr. Keys. So really, it is the Pfizer manufacturers that have pushed for children down to the age of 12 to actually receive the vaccine. And that's been done in jurisdictions where Pfizer vaccines are available. The other entities, AstraZeneca, Moderna, Johnson & Johnson, are still at 18 plus. The Sinopharm has asked for consideration, but it is nowhere near approval at this time for the administration of same to children. As you may recall, we are a part of the COVAX facility, and we may be able to get a variety of vaccines later down in the year. We certainly would need to look at the numbers we are getting, the types we're getting, and possibly look at who we may offer the Pfizer vaccine if it becomes a part of our suite of distribution. But being in the COVAX facility, we may have options later on in the year to access other vaccines that may be suitable for children, but we're not quite there at this time.
Thank you very much, Dr. Ennis. And final question I'm seeing here is they're asking what's the justification or the reasoning behind the having persons fully vaccinated to quarantine for 8 days.
Okay, so the real question is why do persons need to quarantine after they have been vaccinated? Is there still a risk? So remember now that persons that have been vaccinated are still at risk of getting COVID-19. And the fact that they have COVID-19 means that they can transmit it. So what is the purpose of quarantine? The purpose of quarantine is really an observation period to see if persons who have been exposed to COVID-19, if they do develop symptoms. And if they develop symptoms, that you keep them away from the general population to prevent the population's risk of exposure. Why is that necessary? One, because we don't have enough of our population that is vaccinated that is protected from that risk of exposure. Two, the number of variants of concerns that there are out there means that the introduction of any of these more transmissible variants in country can give rise to the potential of exposure to the population and rapid spread in the population. So those are essentially the reason why, because persons essentially who are vaccinated can still become infected and transmit, and there is a real risk with the number of variants outside of country that these more transmissible variants can be introduced into country and produce a rapid increase in the number of cases. We know that we have established that we have the UK variant in country, and that there's probably a significant number of persons that do have that variant. We have seen the reports that have shown that the Brazilian variant as well as the Indian variant are also highly transmissible. And the introduction of those in country, because they are now in several countries outside of Brazil and India, can put us at severe risk for a surge that, if they are so transmissible, can put us in serious problems. So that's the reason why we still quarantine persons that are vaccinated.
Thank you very much, CMO. The final question comes from Kirk Wright from TVJ.
Thank you very much. Are you hearing me?
Yes, we are. Go ahead, please.
Good. So, what are you hearing out of schools as to the extent to which they're following the protocols? Today, a particular school held a valedictory service with over 200 students in the auditorium, along with parents and teachers. Would that be acceptable?
The policy position is that the schools would have and should comply with the appropriate protocols, and those protocols are verified by inspection of the health team, and they are in keeping with all the infection prevention and control measures that are under the new orders. I don't know that any congregation over the gathering limits, except where special provisions are made, should be allowed. And certainly a 200-person gathering, to my mind, would not qualify under the existing orders, unless some special permission was given, which I would have to check on. I don't know which school it is, but I'd certainly have words with the Minister of Education, who I know is very alert on these things, and we will see if this has occurred, if there were any special provisions made, and if it is in breach of the rules, then clearly it would enhance the risk of spread, and that is something that we would have to take a decision on.
Thank you very much, Minister. Those are all the questions that we have from our media colleagues. So I'll hand back to you, Minister, for your closing remarks.
Okay, thank you very much, Stephen, and to my colleagues who are here with me, and to those who have asked questions and those who are listening online. So the general message is that we're making progress. We've had situations that have seen us as a country, our citizens, come dangerously close to not being able to get the help that they deserve in our public health system because of high rates of positivity and reproductive rates of the virus. And it is something that we really need to avoid. It's part of the management process. We have taken the necessary decision, we meaning the government of Jamaica, and we have sought to enforce it, Ministry of Health, Jamaica Constabulary, and others. It has not been easy, because we appreciate also the impact on the population generally, but it was necessary. At this time, the numbers are encouraging. The positivity rate is just below 1, which makes it still in a zone that we should be cautious about. The hospitalization rate, though coming down, is still, or we should still watch and encourage further compliance. And we have relaxed, the government have relaxed the measures, or certain measures, in recognition of the challenges of the population, the economic, the social, and the non-clinical challenges. And I think rightfully so, because we need to promote the normalization of activities and address some of the side effects of the restrictions, economic and otherwise. But we are not out of the danger zone. We must continue to observe the protocols. We must continue to recognize that COVID is still very much out there, and that people are still dying from COVID. And people will still die from COVID if the measures are not taken. So I want to just encourage us to continue. We in public health will continue to keep the country updated. We will identify any warning signals. We will continue to accommodate through the inspection and oversight of the measures around infection prevention and control. And I want to just thank the team in the field who have really been working hard. And I also, in closing, want to thank Minister Grange and the Cabinet, the Prime Minister and the Cabinet of Jamaica, who have agreed for a special national award, medal, for frontline workers to be administered, given at a future date. She and I have been in discussion in terms of look and feel of that particular medal. We're thinking of engaging the public possibly in helping to apply the creativity around that. But I really do believe that our frontline workers deserve some special recognition. We're not out of the woods, but over the last year, they have really gone beyond the call of duty. And when I say frontline workers, it's not just healthcare workers, because we've had other critical agencies on the front line in the COVID fight. And I think the government is sensitive to that. We're appreciative of that. And I think Minister Grange's announcement in her sectorial this week confirms the intention of the government to say to those persons, on behalf of the people of Jamaica, we thank you for your efforts, and we will continue to work with you until we see the back of COVID. Please continue to follow the protocols, and where you need to get your vaccine, please go out and get your second dose and your first dose if you qualify at this point in time. Thank you very much. Have a good evening.
Today we are at the National Arena and we are doing a blitz for second doses for those persons who are due today. So one of the features of the double dose blitz today is, of course, that we have some added refreshments. People have to wait. And I want to thank Nescafe for being an important partner here at the blitz. Expecting to about 600 to 700 persons. As of now, we have done about 540, so we're going very well in that we know who is coming. We had called them, we had texted them, and these are persons who got their first dose coming back for their second.
First dose was very organized. The second dose, I come back today and get it. I'm all right.
This is my second jab because it saves lives, right? And the more lives we save, the better off we are.
So thanks to those who came out, thanks to those who have been a part of today. And you're going to hear about many other blitz to come in the future as we make plans to get Jamaica's population inoculated against COVID-19.